wish they had fucking mail in it.
At least something, right? Yeah.
It's a little dry, man.
This is like, oh my. Yeah, I was having. I'll never go here. Last time the freaking with the slant here, it just sucks.
So as you can see, we get on scene. I'm working second half only. My partners are working at 24. So this is my second call of the night. And we get on scene, take down our equipment. That includes the monitor, stretcher, and the bag, or the jump bag. And we make ourselves inside. We make our way inside the facility. We have to navigate ourselves through low light fucking hallways to finally get to the nurse station, which then now we're redirected because the nurse is not there. So we go to the patient's room, and that's when the nurse comes out and talks to us. And so the story is that 60-year-old female who is O2 dependent tends to remove her O2, and whenever she feels ill, right, she calls 911 on her own private cell phone. And that turns out to be the case in this case. Nurse practitioner comes in, assesses her. Turns out her SpO2 is low because she removes her own nasal device. But then elicits to, go ahead and just transfer her out and give her what she wants. And so that's kind of the story that I'm getting from the nurse. Her SpO2 is low because she takes off her nasal. So I make contact with the patient. She's coherent, COA times 4, GCS of 15. I ask her, what are you feeling? She says that she's having difficulty breathing, and she also has abdominal pain. And I tell her, or ask her, where is your pain? And she points towards her left side flank area. She reports at 7 out of 10, pressure-like, that she's had it for 2 weeks. So I check for lung sounds at that very moment, since obviously that is worse than abdominal pain. And she does have congestion present to both left side and right side. And so then I get a SpO2 reading of 86. I apply back her own nasal, and I think I went up to 4 or 6 liters per minute. Nothing more than 6, because if you're doing more than 6, then you're doing a normal breather instead. So 6 is the limit on a nasal. We transfer over, apply the monitor, and we move out. As we're moving out, I'm trying to get the BP, and we would finally get to the door. We have to get keyed out, so we're waiting to be keyed out. I notice her pressure comes back low. So her first pressure was 79 over 57. I'm going based by my notes that I'm reading right now, the stuff that I wrote down, and which it is alarming, right? But then her MAP, which is what you need to look at, her MAP is at 66, which is minimal, right? 65 is the minimal. 60, you could get away with it, anything less than 60, 65, the kidneys are suffering, and you go into, kidney failure and stuff. So she's at 66. So obviously IV, right? She's also bedridden patient, and they do tend to run the blood pressures to be low, right, compared to somebody who's ambulatory and stuff. But either way, we still gotta do something about it. And then we get in a unit, recycling another BP, trying to confirm what I'm seeing, right? And it comes out low again, but her MAP now, I think it was like 70, 77 or something like that. It's like, okay, so let me work on her breathing, right? Let me get her some butyl treatment only, because they already gave her a steroid. My partner is working on the IV, which is obviously essential. And from from breathing, right, I apply the normal breather. I put it at 10 liters per minute, which is sufficient enough for to get kind of like a mist or smoke effect from the butyrol treatment, and that's when you know it's good. I applied it on her. She is feeling cold. She's reporting cold. I did get a temperature, which I guess that's where I messed up. I took a temperature some point while she had the normal breather. Came out to 91.8, which obviously is false, right? Because it's reading also the air that's being blown in. But anyways, I ended up rechecking it later. So from there I move on. I got to do a 12 leak now, right? Because it's breathing problems, abdominal pain. You never know. So I'm working on a 12 leak. My partner's working at IV. He's working on the second attempt. She has some edema to her extremities. He's having difficulty finding, and he's actually good at IV. So breathing's going in. She's coughing, which is normal, right? Because she does have congestion, and that's how she's going to get it out. 12 leak comes out, comes out within normal limits. There's nothing alarming, such as STEMI or SC depression or Q waves, right? But I do see cardiac history, right? I think it was a bundle branch block I saw, like, if I'm going based on memory. But then either way, if anything does happen, she's a DNR patient, which we did get the paperwork, and so if she codes, we obviously have to respect the paper and the wishes of the patient. And so 12 is done. A butyrol treatment's going in. Partner goes, hey man, can't get the second IV. Do you want me to try? And I think I run another BP, and it's coming out consistently low. And I said, yeah man, try it. This and this and this. I'm working on a report. He tries the third time. He's like, nah man, can't do it. All right, fuck it, let's do it. Let's rock and roll. We are approximately about 15 minutes, 10 to 15 minutes or so from the hospital that she wants to go to. The nearest hospital where we're at is maybe about 8 minutes, but she wants to go, and we have to respect that as well, right? So we have to go further than what, you know. But anyways, so we're en route, and I get the third or fourth BP, right? She says she's feeling better with the oxygen and the NEP treatment. I take a third or fourth BP en route, and I notice her diastolic keeps dropping, and now the MAP, I think it was at 55. I was like, all right. So I get up, right? I go over, and I do an IV en route. My partner was doing 20s. I tried a 22, and I did struggle a little bit, but I managed to find it, and it was on the hand by the pinky area. Patient had a very translucent skin, so the veins was visible, right? The color of the veins were visible, but it gave you a false sense of depth. So we were going very superficial, thinking that the vein was, you know, in the surface area. It turns out that it was actually deep. So I tried it. I couldn't get it. You know, you fish around a little bit, and I was like, fuck, I need to get this, right? And so then I changed the angle, and I poked the vein, and that's when I know. I was like, oh wow, dude, like, you know, it was deceiving. So I got the 22 gauge IV and gave her some fluids. I gave her about 250 from then to when we got to the hospital. BP went back up. I think when we got to the hospital it was like 106 over something, MAP of 89, 90, something like that. She reports feeling better. So this is the thing about like PEL patients. It's very difficult to tell if they're more PEL than normal, besides looking at like the mucous membranes, like the lips and the eyelids and stuff like that, which those were okay. But I noticed when we got to the hospital, she got she was still, you know, her normal skin, but she was a tint of pink. And I was like, wow, dude, that's crazy, right? It's difficult to tell in those kind of patients who those have that kind of skin. But anyways, she reports feeling better. She thanked me, I guess, for taking her serious and obviously for treating her, because she was also like, she was coherent all the way. And I was like, ma'am, I need to try the IV. You need it. And she's like, okay. And so she was kind of had a good attitude about it. You know, she knew that how important it was. Obviously, she wanted to feel better. Anyways, we got to the hospital, gave my reports to the triage nurse. We waited a little bit. I got her some blankets because when I did recheck her temperature without the NEP treatment, it was 94.8. And so when we got to the hospital, I did cover her up, but when we got to the hospital, I turned off the AC as well. We got to the hospital, I gave her some blanket, and I checked with the thermometer they use, and it was 98.8. So, which that helps with diffusion, which obviously the breathing problem. And obviously that helps also with blood pressure. And that's pretty much what the call was. Nothing. It was serious, but nothing critical where we required critical treatments. Just simple O2, albuterol, and IV fluids, and then temperature management. Any questions? Leave some comments. I'll reply as I can. Thanks for watching. Thanks for supporting. See you guys later.